Okay, I understand the recording started. So here are the two objectives for our session. So in the first half, we will learn facts on alcohol use and its impact on health, mostly negative health outcomes. And subsequently, we will learn so we can explain to others about 5 key alcohol indicators and measurement with Michigan as well as the US data. So I'd like to start by sharing the behavioral health outcomes. Here are the most recent estimates of people with substance use disorder and by type of substance in Michigan. This is based on the National Survey on Drug Use and Health from SAMHSA. And as you can see, the majority of Michigan residents did not have the substance use disorder in the past year. That's 93%. But 7% or 618,000 individuals were estimated to have some sort of form of the substance use disorder. The most common form of substance use disorder was alcohol use disorder. And there were over 500,000 people were estimated to meet the criteria for alcohol use disorder. When we say alcohol use disorder, and then they meet the criteria for alcohol abuse or dependence based on the DSM-5. DSM stands for the Diagnostic and Statistical Manual of Mental Disorders. The 5 means the 5th edition. Alcohol is also the most frequent crime code data from treatment episode data set. The table shows 2 years, fiscal year 19, which is a pre-pandemic year, and the fiscal year 22, which is the most recent data point. So compared to fiscal year 19, the proportion of primary alcohol, cocaine, and methamphetamine admissions increased, while the proportion of primary heroin, prescription opioids, and marijuana admissions decreased. These changes were also shown in drug poisoning, drug overdose death. So next, I would like to share some of the picture. So when Mike contacted me a couple months ago about the Shoalition, I was working on this particular fact sheet. So you are looking at the different, like the slightly different form of the fact sheet that I was working on. So the title is The Other Drugs Involvement in Opioid-Related Overdose Death. So when we describe the drug overdose death, the over 80% or close to 80% were opioid-related overdose deaths. So that's the 2,539 in 2021. So that's and then 60% of opioid overdose deaths involved other drugs. Frequently, a drug overdose death involves more than one drug. And for the case of the opioid overdose deaths, most frequently combination opioid and cocaine. So it means that cocaine was present in 30% of opioid overdose deaths. And I'd like to point out the alcohol here. So alcohol was also present in 13% of opioid death. So we look so far we've looked at some of the behavioral health outcomes. So I'm going to turn into the public health side. Let's be clear that we are on the same definition, because I am going to talk about excessive drinking or sometimes binge drinking, sometimes heavy drinking. Oh, there is a typo, I'm sorry about that, the heavy drinking. So binge drinking is the most common form of excessive drinking, and it is defined as consuming 4 or more drinks for women for single occasion, 5 or more drinks for men on a single occasion. And I'm sorry about the spelling will catch it is heavy drinking. So for heavy drinking, it's 8 or more drinks.
Oh, I'm sorry. I'm sorry to interrupt. It's just I'm getting a lot of breaking up. Are you guys also getting that? Is anyone else getting that?
Yes.
Okay. So I'm wondering, I'm not sure if this would be helpful or not. But sometimes I find it helpful, like if you turn off your video, like if your internet's kind of lagging a little, maybe that would be helpful. We could try it if you're
Sure.
comfortable with it.
That increases the bandwidth a little bit, so yes.
Okay. I did that. Okay. Hope.
Okay, yeah, let's try it. I guess if it continues to happen, then I'm not sure. We'll go from there, but thank you.
Okay, let's let me go on. So with that, the definition of the binge drinking and heavy drinking in mind. So I know that you would agree that we cannot discuss substance use and mental health without the addressing the impact of the COVID-19 pandemic. And in earlier part of the pandemic, we heard and we saw all kinds of reporting about increased substance use and the mental health issues. So I brought a couple things, or actually I brought 4 things for you. Either I have directly access to the, or I researched to find the data information. So there were definitely increased in alcohol consumption. But when, according to the one data set, the BRFSS is the annual survey for adults 18 and older. But only for the adult heavy drinking increased by 10% from 6.2% in 2019 to 6.8% in 2020. And it dialed back to 6.4% in 2021. The secondly, there were increases in alcohol sales, and it's based on the Michigan Liquor Control Commission. And alcohol sales increased by 20% from $1.5 billion in 2019 to $1.84 billion in 2020. And I couldn't get the 2021 data, but I know that there were a decrease noted in 2021. And again, there were increases in hospitalizations due to liver disease. So hospitalization rate due to all liver disease increased by 4% from 2019 to 2020. And lastly, the alcohol-induced liver disease death rate increased by 30% from 6.2 per 100,000 people to 8.1 per 100,000 people. Then again increased to 8.9 per 100,000 people in 2021. So that would be 10% increase from 2020 to 2021. So no, I was wondering, because I'm mostly familiar with the drug overdose death, and then I was just wondering, what about the alcohol poisoning overdose death? And I found this information from CDC. The CDC says that about 2,300 people die each year from alcohol poisoning, and these definitely are a preventable death. So the table shows the most years for both Michigan and US. So needless to say, the alcohol poisoning and alcohol overdose death is a tragic outcomes of excessive alcohol use. And the 1/3 were the individuals ages 55, 64. years in both 2019 and 2020 in Michigan. This is just the duplicated slide, but I would like to point out that the parts that I highlighted in yellow, any drinking by people who are pregnant or younger than age 21 is also considered excessive drinking. Now, let's not forget that. In addition to alcohol overdose or alcohol overdose death, the excessive alcohol contributed more than 140,000 deaths each year in the US. So it shortened the lives of those who died by an average of 26 years, and usually involved adults aged 35 or older and males. And the death mostly due to health effects from drinking too much over time. So that'll be the excessive alcohol use over time. And the effects will be this, including cancer, liver disease, and heart disease. So I look up the life expectancy for Michigan. The average life expectancy for Michigan residents were 76 years of age for both men and women in 2021. So that's, if you subtract the 76 minus 26, you can see the life expectancy for those who drinking too much over time. So let's move to the second objective to talk about the 5 specific alcohol indicators. The substance abuse mental health indicators were adopted by the Council of State and Territorial Epidemiologists in 2016. And Michigan was selected to field test the implementation with 3 other states in 2017. And I got the opportunity to work with the CST to field test implementation. And a year later, 10 other states and 5 local health departments were in a second round of pilots. So in the substance abuse and mental health indicators, a total of 18 indicators were included. So indicators 1 through 5 are involved alcohol. So I'll go more details later on. And the indicators 6 through 10 related to drugs. So drug indicators include drug overdose mortality, hospitalizations attributable to drugs with potential for abuse and dependence, prescription opioids per capita. Mental health indicators include suicide rate, hospital discharges from mental disorders, and emergency department visit for intentional self-harm, youth suicide attempt, and adult mental illness. So when I participated in the pilot study in 2017, so I was asked to provide all this data from Michigan for the 18 indicators. So here's the first alcohol indicators, adult binge drinking. The measurement is actually also the definition, and but this is the adult binge drinking will be measured by adults age 18 and older who report having 5 or more drinks for men or 4 or more drinks for women on one more occasion during the past 30 days. The data source will be the Behavioral Risk Factor Surveillance System, and it is sponsored by the CDC. The prevalence of adult binge drinking shows the marginal but steady decrease since 2019. Again, it is marginal, but the percent of adult binge drinking has been higher than US prevalence. So what else do we know? This was more for me, like what else do I know, or what else do we need to know? So according to the one article, for US data, among adults who reported binge drinking, this is from the 2018, the 25% of them doing so at least weekly. And again, the 25% consumed at least 8 drinks on an occasion. So that's the US data. And I couldn't find any latest, but so that's the based on the 2018 data. So for Michigan, using the 2021 result from the BRFSSS, the binge drinking, the prevalence was higher among men than among women. The prevalence was highest among ages 25 to 34 and followed by ages 18 to 24 and 35 to 44 years. The binge drinking increased with the income. So for those who have household income more than $75,000, almost 23% reported having the binge drinking. The binge drinking also is the prevalence is higher with uninsured and also higher among Hispanic adults compared to other race and ethnicity groups. And the indicator number 2, alcohol indicator number 2, the youth binge drinking. So youth binge drinking is measured by the students in grades 9 to 12. So that's those are high school students who report having 5 or more drinks of alcohol within a couple of hours on one or more days during the past days. But that was, they stopped using this definition in 2015. And 2017 survey cycle, they introduced the gender-specific definition, just like for adult. So the 5 more drinks for male high school students and 4 or more drinks for female high school students. Some of you know, or many of you know, the Youth Risk Behavior Surveillance System, also sponsored by CDC, but data only available in odd years. So we only have a 2 data wave, which is 2017 and 2019 here. And I look up yesterday, and I even look up this morning, but 2021 data not available yet. So youth binge drinking remained the same in US and no significant changes in Michigan. So what else do we know? According to the 2019 Michigan Youth Risk Behavior Survey found that among high school students, 25% they consumed alcohol or they drank alcohol during the past 30 days. And almost 40% obtained the alcohol by someone giving it to them. And 15%, close to 15%, rode with a driver who had been drinking alcohol. And close to 4% of drivers drove after drinking alcohol. So I'm sure you can, like right away, to catch some prevention, like the messages and the prevention things that we can do, like don't give someone or don't give alcohol to the students, the kids, or we can educate them like do not be in a car when they think the driver have been drinking alcohol, like the prevention, so that we can do some prevention here. And in addition, female high school students were more likely to drink alcohol and binge drinking than male high school students. And gay, lesbian, or bisexual high school students were more likely to drink alcohol and binge drink than heterosexual or straight students. Number 3, alcohol indicators. It is talking about the alcohol-related crash death. So alcohol-related death of a person involved in crash of a motor vehicle traveling on a public roadway, and the death has to occur within the 30 days of the crash. And deaths are considered alcohol related when a driver had a blood alcohol concentration more than a 0.01 gram per deciliter. So 0.01 is not legally impaired, but CST decide to use this BAC. The data source with the fatality analysis reporting system. It's a national data system. So alcohol-related crash death rate increased by 19% in Michigan from 2019 to 2020, compared to a 14% increase in US during the same time, from 2019 to 2020. So then what else we know? So this table shows the total traffic fatalities by highest driver blood alcohol concentration in the crash in 2020. So I used the red colors to show that these two columns are like the legally like the alcohol impaired driving. So alcohol impaired driving fatalities accounted for 28% of all traffic fatalities in Michigan in 2020, and roughly same for the whole US. The strikingly, among the 306 alcohol impaired driving fatalities, 67% were in which at least one driver in the crash had BAC of 0.15 or higher. I know that I don't need to say, but what does BAC 0.01 means? Like the BAC 0.01, it only takes 12 ounces of beer, or just one bottle or one can of beer it takes to reach the blood alcohol concentration for 0.01. So to reach the 0.08 doesn't take too much, like two or three drinks for women, or 3 or 4 drinks for men. So let's not forget that. And the indicator number 4 is the mortality from liver disease and cirrhosis. So it is measuring the death with underlying cause of death identified as liver disease and cirrhosis using the DICD codes. So they specified a very specific codes. So the liver disease and cirrhosis includes alcoholic liver disease, chronic hepatitis, and fibrosis and cirrhosis of liver. Mortality from liver disease and cirrhosis showed a steady increase over time. So from 2016 to 2021, the death rate increased by 48% in Michigan. And what else do we know? So I found some data, especially for the data from Michigan in 2021. So as I mentioned in the previous screen, a slide, the liver disease and cirrhosis death rate was 15.1 per 100,000 individuals in 2021. And the kidney disease and death rate has a comparable death rate. So the liver disease and cirrhosis death was the top 10, actually the 10th leading cause of death for Michigan. And the 9th leading cause of death was a kidney. And number 1, the leading cause of death was heart attack. So this will be the last alcohol indicators. The state excise tax on alcohol. So the measurement is the state taxes levied per gallon of beverage at the wholesale or retail level by beverage type, reported separately for beer, wine, and distilled spirits. So I have the table showing both Michigan and the US median and the range of the tax for beer, wine, and distilled spirits. So you can see where Michigan stands, because you can see the range for the tax for beer and US range from 2 cents to $1.29. And for wine, the US, across the US, the tax ranges from 20 cents to $2.50. The Michigan, our state is a control state. So that means the Liquor Control Commission, they take care of the sales of the distilled spirits. But the US, overall, the tax ranges from $1.50 to $14.25. So what does it all mean? The takeaway is what you already know. The alcohol indicators are used to measure and monitor excessive alcohol use and related health and social consequences, including risk of liver disease and alcohol-involved traffic fatalities. Public health surveillance for alcohol use, its consequences, and risk factor is important for prevention and control. So by monitoring alcohol indicators, we can raise awareness of the health and social consequences for individuals and society at large. We can also strengthen prevention and treatment of harmful use of alcohol. And we can encourage to use alcohol screening tool. The one free online-based tool that I include, for example, is the one to check your alcohol use. It's from the CDC, and it's online-based. There are like the 7 questions you can answer, and then they will be able to how you are doing, and that they also help you to create a plan for those who would like to reduce their alcohol use. So this slides put some resources for you. So there are some publications and the websites and communications campaign that I would like to draw your attention. As you know that currently the MDHHS doesn't have the alcohol epidemiology program, but up until 2020, and these are probably the last and the recent publication from or by the alcohol epidemiologists. And then I also include the 2021 Michigan epidemiological profile, which I'm responsible for, and it has a lot of indicators, not only for alcohol, but drug use, tobacco, marijuana, prescription drugs, as well as the mental health. So if you get a chance, please take a look. And a couple of websites that will be helpful for you is the substance use prevention, which is our website managed by our section. And then if you go to the excessive alcohol use at a glance at CDC, you can get a whole lot of information. And they have, not only that they have also the good data information, they also have some like the free graphics that you can use. In fact, I used their free graphics for this presentation. CDC also has the Drink Less, Be Your Best, the media campaign. So please be sure to visit the website. And the Impaired and You Know It is the 30-second video created by our Michigan Office of Highway Safety Planning, the media campaign. And lastly, These are the several references related to alcohol and COVID-19. Actually, the first article, if you click the first article, and then the rest of them actually based on the first, the news articles. So with that, that is the end of my presentation.
All right. Thank you so much. Those of you that have some questions for Sumim,